supporting the global strategic plan and the public health implication of rabies. So there are several additions that were incorporated in 2018, like a case definition for dogs with rabies, possibility for disease control for zoning, so there is a possibility to control rabies in a specific zone and then declare freedom on that zone. There was some section fully elaborate on surveillance article. Before there were not guidance on rabies surveillance. I think that it's a very valuable recommendation that invite everybody to take a look, and also a section highlighting the importance of cooperation with competent authorities when it comes to rabies elimination. There was 2 points that I would like to focus a bit more in this presentation, which is the self-declaration of freedom of dogs-mediated rabies of the entire country, or being by zone, and also the endorsement of the official control program. So let's try to start with the first, with the self-declaration of freedom from rabies. The chapter, the provision, the international standard, allows declaration of freedom of all species in animals, or only freedom of dogs-mediated rabies in dogs. But what is a self-declaration? Well, a self-declaration is basically an evidence-based documented statement that is made by the OI delegate, and it's totally under his and her responsibility. These evidence-based documents, they need to prove, they need to provide evidence of compliance with the terrestrial code, with international standard, and in particular with chapter 1.6, but also most importantly with article 8.14.2 and 8.14.4, where they describe what are the provision for a country or a zone to be declared free of rabies in all susceptible species or just in dogs. The second set of documents, which is also important to consider, is the SOPs, the Standard Operating Procedure for the Self-Declaration. It's available in the website, and there will be you will see a clear description of what are the different steps that a country need to follow, so they can declare, they can send the declaration to the self-declaration to the UI, and for the UI to make available in the UI website. But what is a OI endorsed official control program for dogs-mediated rabies? That was a big introduction, big change in the chapter, and for first time rabies is included in the list of disease for what there is official recognition. And this recognition, when it's come to the official control program, it focuses on the technical quality of the rabies control program. That means there is an international recognition that the activities, the plan, the strategy you got in your country, it's according to international standard, best practice, and that gives you enough assurance that we are in the right track. This endorsement of the national control program, this recognition will be extremely important to gain the political will, but also to mobilize resources. As we know, that could be, again, an element of a big gap sometimes in order to progress towards elimination. So when to submit or to claim for, to submit or apply for the official control program, there is 3 elements that we all need to consider. First of all, of course, is the international standard. There is a specific article, which is Article 8.14.11, where they describe very in detail what are the characteristics, what are the provision, recommendation for a country, for a national control program in order to be endorsed. There is a questionnaire. A questionnaire is a checklist where they elaborate a bit more and guide countries in preparation and providing all the evidence, collecting all the evidence that need to be put together in a dossier in order to be submitted to the UI. And the third element to be considered is the procedure. As it was the case in the self-declaration, there is a well-detailed standard operational procedure in the UI website where describe the different steps. But what is the endorsement process? What are the different steps? Well, the first thing is a country's application. The delegate of the country needs to submit the dossier to headquarters. And there is a deadline that for the rabies endorsement control program, it was the 18th of September. I'm quite happy to say that I was we have received quite a few dossiers, so I'm pretty satisfied, and I hope that these dossiers are on high quality and can be endorsed. So once the program arrives in the UAE do a quality check, then it's submitted to the ad hoc group for expert evaluation. So they will control and they will check the validity of the information, and that will go to the OI Scientific Commission for Animal Disease, what we call the SCAD. They will assess, they will study the recommendation of the experts, and if everything is positive, they will be submitted to the Director General and also submitted to the General Assembly. That will happen next year in 21. So hopefully in the next General Assembly, we might be able to see a photo like this one. And this one, my colleagues from Namibia might recognize. It was the first time an African country was recognized as with a status of negligible risk of BSE. So let's try to hope that next year there will be plenty of photos for African countries, meaning that our programs are technically very sound. So in summary, the 2 points I wanted to bring in this presentation is the endorsement of the official control program and the self-declaration. Both processes support each other. As I said, the official endorsed control program, it's an indication of the technical quality. And the self-declaration, meaning that you reach your goal and your country, rabies is no longer a risk. And allow me to finish with this statement that was made by Dr. Monique Eloa a couple of days ago in the United Against Rabies events that I'm pretty sure most of you participate as well. And you probably hear what she said, but I wanted to highlight here. She highlighted that if we pull together, if we work all together, we can make the elimination of human death from dogs-mediated rabies a reality. So I think this is an important message that probably I would like to close my intervention with this statement, because if we work together, rabies elimination is feasible. And with that, I thank you for your attention, and I wish you good continuation of this webinar.
Prof, are you there? Well, thank you very much, Dr. Gregorio, for that presentation. We still remind participants that anytime you can pose questions to Dr. Gregorio or to the speakers online. I don't know if Professor Luinel want to say something before we move on to the next speaker.
No, so just to thank you, Gregorio. I know from the program from yesterday, we allowed a question or two from the audience, essentially just to see the presenter's face. So we'll allow one burning question. Otherwise, we're going to let questions go into the chat room and also let questions stand over to the end of today's webinar. So I don't see any hands up, so I think we can proceed to the next presentation, and I would appreciate if you could introduce the next presenter, Dr. Mutapela.
Thank you, Prof. We are going to now get Dr. Rachel Tidman. Dr. Rachel is currently a global rabies coordinator based in OIE staff, in other words. She contributes to the development and maintenance of strong synergies between the Tripartite, OIE, WHO, and FAO, and other partner organizations. And she coordinates the United Against Rabies activities to support the implementation of the global strategic plan to end human deaths from dog-mediated rabies by 2030. She has worked in a range of different settings, including clinical veterinary medicine, global health policy, and disaster response. Before joining the OIE, Rachel was a consultant in the neglected zoonotic disease department of the World Health Organization. She holds a Bachelor of Veterinary Medicine and Surgery from Murdoch University in Australia and Masters in One Health from the University of Edinburgh in the UK. Rachel, please. Thank you.
Good afternoon, everyone. Thank you so much for joining this webinar today, and I hope you are all keeping safe and well in this very unusual time. Thank you too to our colleagues that organised this event and for providing the opportunity to share updates of our global level activities. I am giving this presentation today on behalf of the Tripartite, and I am aiming to give you a brief overview of the first phase of implementation of the Global Strategic Plan 0 by 30, since its launch in June 2018 up until now, what our progress has been and what our next steps are from here. The Global Strategic Plan was developed by the Tripartite organisations and Garc, following the global call to action in 2015. It was developed to provide an achievable goal and a common plan. And this Global Strategic Plan presents a coordinated, country-centric strategy to eliminate human deaths from dog-mediated rabies by 2030. The plan integrates rabies prevention with other healthcare interventions in a One Health approach to strengthen health systems and engage stakeholders throughout the world in the fight to end rabies. The Global Strategic Plan prioritises the changes that are needed to reach 0 by 30 into 3 objectives. Objective 1 is to reduce human rabies risk by increasing access to healthcare, medicines, vaccines, by promoting mass dog vaccination, and by improving awareness and education. Objective 2 is to provide guidance and data. This is done through effective policies, guidance, and governance, but also by ensuring reliable data to enable effective decision-making. Objective 3 is to harness multi-stakeholder engagement and to demonstrate the impact of our activities. This will help sustain commitment and resources. As there are 105 dog rabies endemic countries, we used a phased approach to break our work plan into achievable target objectives. In Phase 1, from 2018 to 2020, we began by engaging our first group of countries with the greatest chance of success. Our core activities included supporting these countries to prepare robust, budgeted, effective and sustainable national rabies elimination plans that followed a One Health approach, and also by facilitating the coalescence of these plans into a coordinated regional effort. We now have our first annual report which highlights progress that has been made on these 3 objectives and the global work plan since the launch of 0 by 30 in 2018. There has been significant improvement in the last couple of years in the provision of policies and guidance that follow a One Health approach, and the earlier presentation by Dr. Torres outlines many of the new OIE standards and procedures that are part of this continuing progress. The report is available online for anyone who would like to look for further details, and I hope to provide some of the highlights in the upcoming slides. We have made very promising progress under Objective 1. Gavi, the Vaccine Alliance, has prioritised human rabies vaccine for post-exposure prophylaxis in its 2021 to 2025 strategy, which will make human rabies vaccines available and strengthen PEP programs in eligible countries that request it. However, the rollout of this has unfortunately been postponed due to the COVID-19 pandemic. More and more countries are accessing the OIE Dog Vaccine Bank, and since the launch of 0 by 30, the OIE Vaccine Bank has delivered over 2 million doses of quality-assured dog rabies vaccines to 13 countries in Africa and Asia. Additionally, 79% of countries with human rabies cases have had health professionals involved in training sessions for human rabies prevention. And we have all seen the growing success of World Rabies Day events, but there is also an enhanced rabies awareness in several countries and regions worldwide, beyond just those World Rabies Day events. Under Objective 2, as explained already by Dr. Torres, OIE and WHO have updated global standards and procedures to reflect best practice in rabies prevention and control, and the concept of One Health is central to these changes. The Tripartite and partners have provided capacity building trainings with regional and national rabies-specific workshops in more than 60 countries. And tools for countries have been created, updated and refined. Colleagues from FAO, US CDC and Garc will elaborate on these updates in other presentations. Unfortunately, many of our planned on-site capacity trainings have been mostly halted due to COVID-19. However, we have seen a myriad of online trainings and webinars instead, such as this one and the United Against Rabies global event on the 22nd of September. There has been significant capacity building to improve laboratory diagnosis of rabies in over 50 countries, and efforts are being made to improve and facilitate data reporting and collection in countries, and also to promote the sharing and analysis of this data to enable better decision making. There have also been big steps made in linking global databases and sharing of selected official data across sectors at a global level, which avoids duplication. As for Objective 3, to sustain commitment and resources, the Tripartite and partners have worked to maintain the high pace of advocacy, as have countries, and this is exemplified in this webinar by several success stories of national commitment and resource generation. Finally, the creation of the United Against Rabies Forum has just been announced on the 22nd of September, which will help galvanise this sustained commitment and resources. The Global Strategic Plan is now moving into Phase 2, and this transition was marked by our United Against Rabies One Health in Action Partnering for Success event that was held on the 22nd of September. This event has been recorded and is available to watch for those of you who are unable to attend. But a key objective of this event was to bring stakeholders from both the rabies community as well as the wider human and animal health sectors to announce the creation of the United Against Rabies Forum. We need the engagement of a wide range of sectors and stakeholders to continue moving forward, and this forum will provide an enabling and inclusive environment where members and countries can focus on activities that efficiently contribute to 0 by 30, while sharing their knowledge, experience, ideas and information. Forum members will include intergovernmental organisations, NGOs, national governmental institutions, private sector, philanthropic foundations, and academic and research institutions. Working groups will be established to contribute to activities that implement the objectives of the Global Strategic Plan. There are still many challenges ahead. We need more stakeholders, larger scale resource mobilisation at a global level, and sustained political will. However, we have made significant progress, and with your support we can continue to make bigger strides towards rabies elimination in Phase 2. Together, we can make rabies elimination possible. Thank you so much for your time and the incredible demonstrations of dedication and effort from all of our colleagues and partners here today. We wish you a very happy World Rabies Day, and we look forward to much continued collaboration in the near future. Thank you.
Thank you very much, Rachel, for that very good presentation. Once again, we can allow 1 or 2 questions, but maybe before I give to Prof, I have 1 or 2 questions for both you, Rachel, and Gregorio. Maybe starting with Gregorio. Yes, you have reported that there is some uptake on the new standards, and some countries are already lined up to apply for OI endorsement. What has been the general uptake of these new standards in general? What do you feel is the uptake of these new standards on rabies? And for Rachel, what would you say is the most critical hindrance to the implementation of the global strategic plan thus far? And how can this meeting here, looking at the member states, the member countries participating and the participants in general, how can they assist? Prof?
So thank you very much for those questions. I also see a question in the chat box, which I will come to just after. So please, Rachel, could we start with you?
Of course. Good afternoon, everyone. Thank you very much for having me. My internet connection is a little bit unstable, so I will leave my video off if that's okay. But yes, regarding...
That's a shame, but it's we will have to accept that.
So yes, so regarding kind of our obstacles for moving forward, I think certainly in terms of kind of getting some wider partners on board. I know we've made some incredible progress with rabies partners and things in the last couple of years, and we've really come together. But certainly, I think something that we're seeing with the COVID crisis at the moment is that we do need a wider range of stakeholders and kind of branching into a bigger One Health aspect and excuse me, and into animal health system strengthening and human health system strengthening. I think we really need to kind of broaden into different sectors and different stakeholders and get them on board.
Okay, thank you for that. Comments from your side, Gregorio? Okay, I'm not sure if Gregorio is online, but there is a question from Ryan Wallace in the chat box. This question relates to he refers to the presentation on the updated standards, particularly for diagnostics, and then also referred to rabies laboratory trainings across the world from the UAR reports. So what is the official stance on the role of rapid? So these are lateral flow tests. Or do you want to make any comment on that? I know it was a discussion yesterday, and I know Dr. Conrad Fröhling talked quite a bit on this issue with all of the caveats, and I know that was recorded. And Ryan, I'm not sure if you were part of the audience yesterday. I don't recall that I've seen you, but maybe we can leave this to be dealt with from the recording from yesterday. Would that be in order? Okay, fine. He says that's perfect. So thank you very much. I see the audience has grown a bit. It's growing steadily. So we're at 107. And as I said, people will come and go as it is with meetings. And so next on the program, we're going to have an update on FAO involvement on rabies elimination programs as it relates to Africa specifically. And of course, we have Dr. Charles Bibay, who will give the presentation on behalf of the FAO. Charles is originally from Cameroon. So most of you know him. He's been involved in programs in Africa and also Europe for more than 20 years. He's been focusing on capacity building in the animal health sector, including many of the diseases that are zoonotic. So without further ado, Charles, we're looking forward to your presentation.
Good morning, everyone. My name is Charles Bebe, working for FAO in Africa, and welcome to this webinar, which actually today is going to talk about sharing progress of rabies elimination in Africa. And I will give you an update on FAO involvement on rabies elimination in Africa. Next slide, please. Next slide, please. Well, the presentation will be articulated for 5 key agenda items, I would say. So a quick word on the global plan to national objective hub. They are both linked. Institutional setting and national plan, how FAO is supporting also laboratory diagnostic capacity, networking, knowledge generation and sharing. And we would like to end up this presentation with a take-home message. Next slide, please. Well, in Africa, FAO is supporting the global plan that was released in 2018, a coalition with WHO, OIE, and the Global Alliance for Rabies Control, and with the 3 objectives, as you know. And as you know, this first phase now is almost to end. It's supposed to end, be completed by 2020. And FAO supports the countries to cascade the global plan to at national level. Next slide, please. As you know, FAO in Africa is really present at all levels, and this provides FAO with a unique, very unique and exceptional advantage to collaborate with relevant stakeholders at all the levels. We are actively engaged in rabies network activities, such as PaRaCoN in Africa, or at sub-regional levels with the regional economic communities, and also national One Health platforms. With this unique advantage, FAO is really providing assistance to identify and implement rabies priorities, prevention and control activities, engaging with policymakers, technical partners, but also communities and the private sector. Next slide, please. Well, as you can see, it has been reported on many occasions, rabies is a burden, is a high burden in the Africa region. And FAO suppose is also to ensure that rabies is on the top priority of country zoonotic disease list. And as you know, rabies, global plans are country centered. And we are supporting stakeholder meetings that involve multidisciplinary teams from the national to the subnational level, with the aim to foster countries' leadership and build consensus on priority activities. And the rabies control activities we are supporting are really leveraging from the existing One Health platforms or technical working groups on rabies. And in some countries, I think it's worth noting that rabies has actually even triggered the multi-sectoral collaboration and facilitate the interaction between the public health and the animal health sector. Key achievements in supporting to put in place an enabling institutional setting and control strategy plans is really related to the fact that many countries have today, as we speak now, elaborate the multidisciplinary elimination plan. They did in Cameroon, Sierra Leone, Liberia, Ghana, Cote d'Ivoire, so many. Kenya is one of those. But also the establishment of One Health platforms, technical working groups, and also regional technical groups actively working on rabies control activities. Next slide, please. One of our key FAO support in Africa is also to ensure that rabies is accurately and safely detected, which means we are providing national laboratories with equipment, microscope, reagents, and also we're providing, with the support and collaboration with other partners, we're providing trainings on sampling techniques, sample transport, shipment, particularly when it comes to ship, samples for confirmatory diagnostic to OIE reference laboratories. We are also supporting prophylaxis tests to make sure that the country complies with international standards. We're also supporting rabies vaccination for lab technicians and field officers, sure that they are not going to be infected either by manhandling rabid dogs or samples. And troubleshooting meetings are really organized to fill the gap at country level. Next slide, please. The couple of slides that you see are really displaying the scope of FAO's intervention to support laboratory capacity, diagnostic capacities from various perspectives. As I said, lab equipment, on-site trainings. Next slide, please. And this is an activity that we are conducting on a yearly basis from West, Central, and Eastern Africa, as you can see. Next slide, please. So as a result, before I comment this slide, in most of these countries, lab diagnostic capacities have improved, new lab diagnostics have been introduced, sample collection shipment improved, and interaction with reference lab increased. We are also supporting risk assessment, mapping, disease monitoring. For instance, I would like to mention that we have, in many countries, succeed in supporting the countries to report rabies events through the real-time surveillance and using mobile notification system. As the case is now in countries such as Ethiopia, such as Tanzania, Kenya, and we've seen the really improvement of disease rabies reporting. Risk mitigation is very important for us, and this is what we're doing to engage the community for awareness and other prevention measures. We are also supporting the countries to commemorate the World Rabies Days, and we are engaging the private sector. Private vets are really engaged, particularly around the World Rabies ceremonies, either by providing some messages in the media or in the field for massive dog vaccination. Over. Then we also, it's important to generate new knowledge and share the knowledge. And platforms, I've just mentioned, One Health platforms, Rabies Technical Working Group are instrumental to generate and share the knowledge. And we've seen this in many countries and beyond the countries. Here you have some articles that FAO colleagues and in collaboration with other researchers, institutions, have recently published relating to the activities rather on prevention, on control of rabies outbreaks. I think it's important also to mention that this knowledge work generation has also is really given the visibility to local aspects. And this is how we can build that necessary technical capacity across the countries to support either the preparation or the implementation of national elimination plans. Next slide, please. I would like to end this presentation to really stress that 2030 is coming soon, and there is a need, I think, to address some critical issues, and I've mentioned a few of them here. For instance, what is the status of the preparation of national elimination plans in some of the countries today, and what are the critical activities that should be taken to make sure that countries are really on good track. We need also to work very intensively in terms of results mob campaigns at a regional or national level, and also to make sure that these rabies working groups, national level or regional level, are reinvigorated and actively their engagement is improved to promote prevention and control measures. The regional tripartite in Africa is doing a lot, and it's really a platform that could also foster rabies elimination in Africa. I would like to thank you, and I will be happy to address any of the questions we may have. Thank you.
Thank you very much, Dr. Bebe. Much appreciated that presentation from FAO. If there are any specific questions to Dr. Bebe, please do post it in the chat box. In the meantime, some questions have started to accumulate in the chat box. I'll just refer to some of these questions, and they can be answered by anybody who feels qualified to answer it. For example, there's the question from Philip Michel-Bois, which says, wondering if DRID is readily available for use by developing countries. So I'm not sure if Dr. Sabeta is on this call. I didn't go through the participant list, but if he is, you might want to comment on that. Dr. Andre Kutzer, you might want to comment on that. There's a question on the PBS pathway from Dr. Dlamini. What role will the PBS evaluation report play in the rabies status recognition by the OIE? So Gregorio or other OIE delegates might want to approach that question. And then thank you very much, Thomas, for responding to the question earlier on from Dr. Ryan Wallace. Okay, thank you very much. I think we can, there's no specific questions other than thank you very much for the presentation from FAO. Thank you, Dr. Charles. So we can move on to the next presentation. Can I hand over to you, Dr. Letsunayo?
Thanks, Prof. Yeah, I think just like you were saying, I hope colleagues will respond to some of those questions. We have people like Patrick Bastiansen here, who is our PVS expert, and maybe Tid also. But anyway, they'll take them together with the next presentation, which is from Dr. Lamine Diawara. Dr. Diawara is a public health doctor and a medical entomologist by profession from Senegal. He is currently the focal point for the fight against neglected tropical diseases, NTDs, at the Inter-Country Support Team for West Africa, normally called ISTWA. He served ISTWA since October 2014 in charge of NTDs at that level. He is also a focal point for the fight against rabies and dengue fever for the WHO Africa region. He worked for almost 25 years in the fight against onchocerciasis in Africa, and in particular in Senegal, his country of origin. He also carried out research activities on malaria and NTDs, particularly onchocerciasis. So Dr. Diawara is going to give us an update on WHO involvement on rabies elimination program in Africa. Dr. Diawara, thank you.
Hello, everybody. I am Dr. Lamine Diawara, focal point for rabies program in Africa. I am going to present to you the updates of WHO involvement in the African rabies elimination program. First of all, I want to tell you that rabies is a disease common between animal and human. Well, it's a viral disease. So we call viral anthropozoonosis disease. Transmitted to human from an infected animal. Dogs are more responsible for 99% of human infections. Human rabies is always fatal once clinical symptoms appear. So prevention remains the priority of the National Public Health Program. The rabies is present in more than 100 countries and territories, and in almost all 47 African member states. We have around 24,000 deaths per year, and children attending school-age children between 5 to 14 years old pay the heaviest price for this disease. But the current data available in the region does not reflect the reality of the situation. We actually have between 2018 to 2020, in 20 countries, we have data and give us 1,417. This is not the reality. We build a global plan around United Against Rabies Partnership. We have WHO, OIE, FAO, and Garc to achieve zero human deaths from dog-transmitted rabies by 2030. This is a big objective, and we are working to attain this objective. But the implementation of this fight against rabies is very timid in Africa because of, first of all, an unavailability of vaccine, immunoglobulin, and low mobilization of funding. And also, we have a weakness of the multi-sectorial management approach. This approach is very important, and it is so weak in Africa. And also, the data management system is almost non-existent. The situation shows us that we have many challenges in our region to achieve this ultimate goal by 2030. This slide shows us the situation of the global burden of the dog-transmitted human rabies. You see, we have in Africa, in West Africa, in Central Africa, in Eastern part of Africa, you see the death is concentrated in these sub-regions. And when we see about the death rates per capita, you see the situation is copying the same situation. This is a recent situation we have in 2015. It's why there is a big collaboration between WHO, OIE, FAO, and they have a memorandum of understanding signed by these three organizations to have a long-standing partnership with a strong focus on tackling health challenges, including rabies. And this MOU was signed in April 2010, and also we visit again this MOU between these three parties commitment in October 2017. This is the global strategic plan we have to achieve this objective to get zero human deaths from dog-mediated rabies by 2030. And we have a big collaboration called the United Against Rabies. We have WHO, FAO, OIE, and Garc. The situation in the world of the rabies, we can tell you that, first of all, 99% of cases are from dogs. This is too clear. And we have also one death by rabies each 15 minutes. And the children are paying the heaviest charge of this problem. Because when we have 10 days for our children, it is very used to this part of population. But we know that the rabies is 100% preventable by vaccination. Vaccination to population of dogs and also to human population. So it is possible to get this goal we have in this program. And also, we have to work for the interaction between man and animal, you see. Because when we have no bite, we have no rabies. And each year, on 28th September, it is the World Rabies Day. We take this opportunity of this day to have advocacy, sensitization, and information to population about rabies. What are strategies to tackle rabies? WHO recommended many strategies. We have mainly three strategies. The first is to control the control of rabies in domestic animals, vectors of the disease, and it is mainly dogs. We have to vaccinate dogs to control the dynamic of population of dogs, and this point is very important. This point is ongoing better than the side of human. The second strategy is the post-exposure prevention. When the people is in contact with virus, because it's bitten by dogs or licked or scratched by animals, we have to take care of this person to prevent the rabies. Because as I tell you, when we have the disease, it is death 100%. The last strategy is the pre-exposure prevention. This is before the virus comes to the person. It is for veterinary professionals who are working regularly with animals, and also those people who are working with animals. And also people who are working in laboratory because they are working on with the virus. And what we know that in Africa, we have a week of rabies prevention and control initiative existed in countries since colonial and post-colonial periods. But these strategies are too weak and they need to be updated to adapt to the current context. Actually, what are the main achievements in by WHO in the African region? First of all, we start by registration of human rabies in the list of 20 neglected diseases, tropical diseases. At the launch of this program, it was on 2007 to 2008. But in this period, when we during the launch of this program, the main activity was NTD requiring mass drug administration. But during the second generation of the master plan, we support countries, we orient them to take into account the fight against rabies. This was at the period of 2011-12. And also recently, in October 2018, we transmitted to countries the WHO position on rabies. All activity we have in the fight against rabies, we give them the WHO position because people are working in different manner. We have to emphasize the experience in two countries in Southern African part. It is in KwaZulu-Natal, in Republic of South Africa, and in Tanzania. They have a very good program ongoing. It was a pilot program. And we got multiple requests from countries. And WHO support them because when they have a surge in cases of human rabies or dog bites, they ask WHO to support them. And WHO has supported countries following more than 10 outbreaks reported in the last 5 years. And recently, we tried a laborious attempt to collect rabies data from health and livestock sectors for the period between 2015 to 2017. The result was not very good because we have only 5 countries among 47 in the region were able to present them. It was Benin, Côte d'Ivoire, Gabon, Mauritius, and Senegal. What are actually the immediate prospects? First of all, we need to strengthen the collaboration of stakeholders in WHO and with partners. The second point is to make available quality vaccine and immunoglobulin for countries to manage the post-exposure prophylaxis in human population. And also to encourage the vaccination, the dog vaccination, to get good coverage in this population. And also in country, we need to promote frank collaboration between the human and animal health sectors in countries. This is very important and not very easy. We also have to activate the One Health platform in countries. This exists, we have to work, and we can get a better result for that. Also, we need to mobilize substantial resources for rabies control in countries. It is not the case actually. And the last point is we need to strengthen the routine health information system on rabies data. And we hope that next year, even if we have in a very difficult context with the coronavirus, we can move forward getting our goal we need. Thank you very much for your attention. Thanks.
Thank you very much, Dr. Diawara, for that presentation on WHO. We have received several questions in the chat box. I hope the presenters are looking at them. One of them from Vincent regards to the cost of human post-exposure vaccine being too high, and what is the Tripartite doing about that to help? And also one on the challenges of local vaccine production because of shortages of FITC conjugates for the tighter determination. And could OIE support local rabies vaccine production? And I think Roland, the CBO of Eswatini, is once again following up on PVS. I think Dr. Sebastiansen will be responding to that. And does WHO have any plan to support countries on human rabies vaccine production? I think Dr. Diawara can help in that. But before I let those responses, Prof.
So thank you very much. I think we can deal with those questions in the chat box. I think so Dr. Bastiansen essentially provides us an answer to the earlier question from Dr. Dlamini. Let's see if that discussion goes any further. The question on WHO plan to support countries, I think, I think Dr. Diawara can answer that in the chat box. What I noticed was that there was still somebody in the wrong chat room, at least in the wrong conference room. So I don't know, Patrick and Tenzin, if you have a notice in the other room that people should migrate to this one. I also noticed Dr. Boy Kikumoto joined us. Dr. Kikumoto from Ghana. It's a very long time. It's very good to see you. You are in the correct chat room now, or a conference room. So I'm going to, without any further ado, move towards the next speaker, and then we can catch up and see if there are any of these questions that haven't been addressed. But in the interest of time and getting things flowing, I'm going to just briefly introduce Dr. Ryan Wallace for whatever introduction he needs, which is not much. He's going to talk about how to design an effective mass dog vaccination campaign using various different tools. And he has a knack for explaining these things in a very clear manner. So we're looking forward to that. I can only say the last comment from Dr. Diawara in the previous presentation, his very last point was this: strengthen routine health information systems on rabies data. I see this as surveillance. And Ryan, I know that you've got a passion for surveillance, and I think you spent the majority of your time focusing on the implementation of surveillance systems in low resource settings, which is something that I very, very much appreciate. Thank you for all the work you've done in the last 8 years since you've joined CDC Rabies section, and looking forward to your presentation. Thank you.
Happy World Rabies Day. Thank you so much for joining today's webinar and contributing towards rabies elimination in your community. My name is Ryan Wallace. I'm a veterinary epidemiologist with the Centers for Disease Control and Prevention in Atlanta, Georgia of the United States. I lead the CDC's Rabies Epidemiology Unit, and I'm the director of our OIE Reference Laboratory for Rabies. I and the members of my unit have had the fortunate opportunity to work in many countries around the world, helping to establish rabies control programs and tackling issues such as dog vaccination, rabies diagnostics, capacity building for surveillance programs, and improving access to life-saving rabies post-exposure prophylaxis. Along the way, we've made numerous amazing partnerships with other people just as dedicated to eliminating rabies as we are. In Haiti, a rabies endemic island in the Western Hemisphere, we have vaccinated more than 1.5 million dogs over the past 5 years. We've partnered with NGOs that are vaccinating millions of dogs around the globe in places like India, Sri Lanka, Ethiopia, Malawi, and the Philippines. Today, I'm happy to talk with you about a tool that was developed by CDC with colleagues from NGOs like Mission Rabies and the Humane Society International. We've gathered all of our robust experiences vaccinating dogs across the globe, analyzed the data, and developed a tool that is not only useful at planning dog vaccination campaigns, but is also highly accurate at predicting how successful these campaigns will be at eliminating rabies. Canine rabies vaccination programs are often developed over years and operated for decades to achieve and maintain rabies freedom. Vaccination activities and their related budgets differ greatly between these different stages as vaccination programs evolve. The U.S. Centers for Disease Control published a paper in 2017 that described a common pathway for this evolution of vaccination programs. The pathway was based on experience from Latin America, North America, and Europe, as well as information obtained from pilot projects in Asia and Africa. The common pathway consists of 3 phases: a preparation phase, scaling up of vaccination practices, and finally, sustaining adequate coverage until rabies elimination has been achieved. The first phase, preparation, describes activities that should be conducted to understand factors influencing the success of a vaccination program. This includes activities such as studying the dog population, knowing how accessible dogs are to different vaccination methods, and also involves identifying the workforce and understanding what skill sets are available to operate these varying methods of vaccination. At early stages, it can be important to start advocating for your program and studying the cost effectiveness of any proposed interventions. Note that this common pathway does not recommend delaying vaccination while these studies are ongoing. Rather, the pathway recommends immediately initiating vaccination programs, but in a way that allows you to study these factors at the same time. During phase 2 of the common pathway, there begins to be an understanding of dog populations, the vaccinator workforce, and community engagement for these different vaccination methods. During this phase, different methods of vaccination might be piloted to find out what works best for the program area in cost-effective and scalable manners. No large-scale programs have been developed overnight. Phase 3 of the common pathway assumes that the program has found a methodology that is successful, cost-effective, and scalable. Once campaigns are able to reach the 70% coverage threshold that must be enacted to eliminate canine rabies, this needs to be conducted annually for 5 to 7 years before rabies is eliminated. Also, at this stage, a robust surveillance program becomes absolutely critical, since you cannot determine the progress of the program or when vaccination programs can be reduced or discontinued unless you have highly effective surveillance to inform these decisions. When designing an effective vaccination campaign, it is helpful to think of the ways different vaccines, methods, and dog populations are related. For example, if one wanted to design a campaign that is effective at vaccinating well-owned, confined dogs, parenteral vaccines distributed by either central point or door-to-door methods are typically highly successful. But clearly, it would not make sense to conduct capture, vaccinate, release, or oral vaccination to target this population. We can continue to see these relationships, this time if we are targeting semi-confined dog populations. Semi-confined dogs typically have an owner that can present them for vaccination at central point or door-to-door campaigns, but they may also be freely roaming the community and are accessible through CVR and ORV methods. If the target population is primarily comprised of community dogs, more active vaccination methods might be required, including CVR and ORV. However, it should be noted if the community is highly supportive of the campaign efforts, door-to-door and central point vaccination may still be effective for community dogs. And last, if the target population are feral dogs, it is unlikely that any individual will be able to present them for vaccination, and the more intensive efforts of CVR or ORV will be necessary. Luckily, feral dogs are thought to comprise of a very small proportion of almost any dog population, and play very limited roles in the transmission of rabies in the community. In this figure, we see the combination of all of these interrelationships between vaccines, methods, and dog populations. This is not a straightforward relationship, and it is complicated when the target dog population are comprised of a mix of confined, semi-confined, and community dogs. Understanding that these interactions are complex, we set out to design an Excel-based tool that can account for these relationships, as well as the costs of operating a campaign, to help program managers more quickly design highly effective and cost-conscious programs. On the left side of the screen, we have the necessary inputs to design a campaign. This includes the estimate of the number of dogs in the program area and their confinement status. It also has user inputs for the number of vaccines they plan to purchase, and identifies the different methods of vaccination that are intended to be used. We also capture the efficacy of the vaccines to be purchased. And perhaps most complex for here, we ask the users to estimate the effectiveness of each method in each dog population. I will now show several examples of how this Excel tool works. For example 1, we are going to plan a campaign in a high-income urban community. This community has an estimated 5,000 dogs, with the majority, 80%, confined and 20% semi-confined or allowed to roam freely at certain parts of the day. The vaccinators are able to vaccinate approximately 50 dogs per day, which is information the campaign manager has provided to us based on previous performances. The program manager wants to conduct a campaign that uses 20% of the vaccines at central point clinics and 80% through the capture, vaccinate, release method. They intend to purchase 4,000 vaccines for this program. So now here we have the Vax Plan tool. Now that we know the parameters for our campaign design, we can come in, click Start, and start entering data. On the blue side, it's where we have our input values, and you'll see as we start to design our campaign, the green side will automatically populate with the estimates of how effective that campaign will be and how much the campaign will cost. So for this campaign, our manager says the area has 5,000 dogs, and it's a relatively high-income area. Most of the dogs are kept inside. But about 20% of the dogs are allowed to roam freely at certain parts of the day. There were about 4,000 vaccine doses that he's planning to procure, and he wanted to put about 20% of these doses into central point campaigns, and 80% of the doses were going to be allocated to capture, vaccinate, release teams. And so just with that little bit of information, the tool is able to estimate how effective that campaign will be. What we can see immediately is that if we're worried about total population coverage amongst all the dogs, this is a relatively poor design. Only 32% of all of the dogs in this community are going to get vaccinated with under these parameters. If we're worried about the free-roaming dog population, the campaign actually would be quite effective, reaching 80% of the free-roaming dogs. However, this design has a large degree of vaccine wastage. 60% of the vaccines are estimated to go unused, and it has a very high cost at $6.36 per dog vaccinated. Most programs would not be considered sustainable at that very high cost. So when we look at this campaign design and this particular community, we can see that most of the dogs appear to be relatively well owned. They have owners that keep them confined. And one of the better methods to reach these dogs is to do central point vaccination. So we can come into this tool now and say, well, instead of 20% of our vaccination effort going to central point, let's change that to 80% of our effort, and let's reduce the amount of effort we'll put into capture, vaccinate, release. And again, the tool will automatically update its estimates. And here now we can see that in terms of total dog population and free-roaming dog population, this is a highly effective campaign. Over 80% of both types of dogs are expected to be vaccinated. There is no vaccine wastage, so it's a very efficient campaign, and this campaign can be achieved for only $2.75 per dog vaccinated. It's a very reasonable cost. So with some very basic parameters of the dog population and understanding what types of methods we're going to attempt, we can design more effective campaigns right from the start, rather than doing a campaign, realizing it didn't work, and having to come back 6 months later or a year later and repeat the effort. Here's another example. This time, we're looking at a typical low-income urban community. Again, this community has 5,000 dogs, but a more distributed population with 10% confined, 40% semi-confined, and 50% community dogs. The campaign manager wants to use 80% of the vaccines by central point and 20% of the vaccines by CVR. So once again, here we are in the Vax Plan tool, and similar as the last scenario, there's 5,000 dogs in this community. But now the dog population is much more diverse, with 10% confined, 40% semi-confined, and 50% always roaming. So right off the bat, we know this is going to be a much more challenging dog population to achieve high levels of coverage. We're still going to procure the same 4,000 doses. And this time, the program manager wants to see what would happen if we had a campaign that was 80% central point and 20% capture, vaccinate, release. And so we can come back over to the results here and see, right off the bat, it's probably not going to be a very successful campaign. Total coverage of 51% and free roaming coverage of 47%. And again, high degree of vaccine wastage. We can actually look up here and see where that wastage is occurring. It's occurring in our central point vaccination method. So we can look at this campaign design and we can say, well, we can probably do better, and we need to reduce our focus on central point vaccination and put more focus on a method that targets these free roaming dogs. So instead of 80% by central point, let's go to 40% by central point and 60% by capture, vaccinate, release. And we can see with this alternative vaccination method, combining central point and capture, vaccinate, release, our coverages become much higher. It becomes a much more efficient campaign, and the cost per dog vaccinated comes down to about $4. And we can continue to adjust these proportions of effort until we come up with a plan that we think best fits the type of dog population that we're addressing. And again, it seems like because of the parameters of these dog populations and the effectiveness of our methods in these communities, we're probably not going to be able to achieve much higher coverage than what we're seeing right here. There are some other factors of our campaign design that we would need to adjust. Now, one way we can try to improve our vaccination coverage amongst this really challenging population of dogs is we can incorporate oral vaccination into our campaign. So with this tool, we can say we'll keep our 45% central point vaccination. So we'll need 1,800 parenteral vaccines for that effort. But instead of CVR, we're going to procure 2,200 doses of oral rabies vaccine. And now this campaign design would be almost equal parts central point and oral vaccination. Oral vaccination targets these free-roaming, less accessible, harder to reach dogs, and the results of this tool reflect that. With this combination, we achieve very high vaccination coverages, nearly 80%. And if you look at this cost per dog vaccinated, you might realize it's actually lower than the previous example where we only used parenteral vaccines. And that's because of efficiencies of vaccination. With oral vaccines, we can vaccinate more free-roaming dogs per day than if we use parenteral vaccines and less advanced methods, like capture, vaccinate, release, which is a very intensive method requiring a lot of training and skilled personnel. So there's this trade-off between the efficiency of oral vaccine, but there also is a higher cost for oral vaccines. But there are other ways we can achieve a highly functioning campaign without relying on oral rabies vaccines, or at least not entirely. We can set our parameters back to a fully parenteral campaign, again back to central point and capture, vaccinate, release. But one of the things we can do is change the effectiveness of our methods. And there's a lot of ways that might happen in reality. We can improve community engagement. We can improve the skills of our vaccinators. We can invest more in community awareness and events like World Rabies Day. We can improve the ownership characteristics of dogs and how they care for, of owners and how they care for their dogs. And all of those things are going to improve the effectiveness of your campaign. And so we can come in here and change some of these things that, some of these parameters. And just by doing these little changes, we can start to see increases in the coverage. Now, one thing we certainly want to avoid is designing scenarios that are completely out of the realm of reality. And with tools like this, it's very easy to overestimate how effective your campaign actually is. So we've included a guide down here that allows you to put in the highest coverage your campaign's ever achieved. Let's say you're a brand new campaign and the most you've ever achieved is maybe 15% vaccination coverage. Well, you're probably a phase 1 vaccination program, and here are suggested values that could be put into this table up here so that the model runs more accurately. If you're a campaign that's only ever achieved 55% coverage, we call you a phase 2B, and again, it gives you the recommended values for your vaccination effectiveness. This model has been used in numerous countries. We have a publication on it that goes into the methods and also a large-scale evaluation we did. And actually, it turns out that these values here provide a more accurate model, a more accurate estimate of cost and effectiveness than the inputs that we got from our very experienced program managers. And that's explained in much more detail in the publication. If you're interested, it's in the references of this presentation, and you can find it online as well. There are numerous other features of the VaxPlan tool, and I don't have time to go into all of them, but just really quickly to highlight, there's no limit to the size of the campaign that you can design with this tool, with this model. We could run a 500,000 dog campaign using 450,000 doses, and it will still give us estimates and costs. We can change these vaccination strategy measures to whatever parameters we think are most accurate. And we also have a cost tab where there's a guide to all the most common costs encountered by a campaign. And this is where you would come in and enter your budget. And this is what drives the calculation for estimated cost per dog vaccinated and the total cost for the campaign. We also have a section here on vaccinator capacity, which is a very important consideration. How many dogs can your vaccinators vaccinate in a day really drives the overall cost of your campaign and how long your campaign needs to operate. And so you can come in and change these to be reflective of the campaign you're trying to design. So really numerous functionalities. I don't have time to go into all of them, but overall it's a very flexible tool. It's a relatively simple model that we've used based on a lot of field experience, and it's been tried out in numerous countries and shown to be very accurate across numerous settings. Again, check out the publication if you're interested in learning more about it. In that publication, you can download a version of this tool. You can also email me to get an updated copy that we have. We've made some upgrades. There's a website version as well that you can access. Thank you very much for listening to this presentation. I hope you will reach out if you have questions. And I would like to acknowledge my co-authors from Mission Rabies, CDC, and the Humane Society International, as well as the programs that share data with us to help validate this tool, including those from Haiti, Goa, India, Malawi, Sri Lanka, and Ethiopia. Thank you very much.
Super. Thank you very much, Ryan, for that presentation. As you've seen from the comments, quite a few people expressed their appreciation for the clarity of the presentation. Quite a number of the questions revolve around the characteristics of the dog population and your knowledge of the dog population, which will determine, how you're going to populate that model, focal point mobile oral vaccine and so forth. And I see that you've addressed some of those issues as it relates to the dog population, and I see that you are talking about doing that this is important and that you can do it in combination with the vaccination campaign, do some sort of survey of the dog population. And you have other discussions around that you have answered. There is a question on how easily this tool is available, and you said that you supply that information and also invite people to email you. Perhaps a question one can ask is, how easy is it to use? Do you need any specific training to be able to use it? Maybe that is something that people might be interested in as well. So thank you very much. I would appreciate if you can just, if you have any further comments on that, Ryan, if you can put it in the chat box. One other question I have for you from yesterday's discussion on the oral vaccines. I know that you've been involved with testing oral vaccines in Haiti, and based on your experience there, but also your experience in Africa, what would be your views on the utility of oral vaccines for African setting? I would appreciate if you could comment on that.
Sure. You can hear me and see me okay?
Yes, I can see you. How are you? Good morning to you.
I'm doing well. It's a little bit early here, so I'm still drinking my
coffee. I know.
So that's a good question, and it also relates to a couple that showed up in the chat box. That there's no standard dog population. Even the methods for estimating populations, people that do those studies rarely ever show the confidence interval around those estimates, and even really robust studies, the confidence interval is huge. So when someone says we've got 150,000 dogs in this community, even with the best methods, that's going to have a huge level of error around it. And so you can't rely too much on the dog population estimates. It gives you a guide, but it's post-vaccination evaluations and getting teams out there afterwards and doing your surveys or putting the collars on your vaccinated dogs. That'll tell you if you were successful or not. Oral vaccination works really, really well in communities with loosely owned dogs. In Haiti, and I think it would be easily replicated anywhere. We saw it in Bangladesh as well. You can vaccinate, one person can vaccinate 80 to 120 dogs in one day. And these vaccinators don't need to be highly skilled, veterinary, animal workers, that have to be able to give an injection or run around with nets. These can be people in the community that just enjoy being around dogs and feeding dogs. So the cost of paying these people will probably be quite low. I think you'll have quite a few volunteers that would be happy to go out and feed dogs. And as long as your dog population justifies it, I think it could be a really useful tool in certain communities. The cost is higher, and so you definitely need to watch for that trade-off. I wouldn't go into a community that's easily accessible with Central Point and start using oral vaccines. It might be easier to feed a dog, but it's going to cost a lot more. And we need to stay very cost conscious about our vaccination programs. They can get out of hand really, really quickly if we get too fancy with them.
Thank you, Ryan. That's really useful. There are some further questions in the chat box. I'd like to refer to those, including the question of cold chain. And we know with oral vaccines, that's more of an issue. So there's a question on thermostable vaccines. And I would appreciate if you could comment on any of those that you feel comfortable with in the chat box. And I really appreciate you getting up early. And thank you again for a very nice presentation. So I'm going to move on to the next one in the interest of time. And so enjoy your coffee. And over to you, Dr. Letsuneo.
Thanks, Prof. Thanks, Ryan, for that very quantitative presentation. I always enjoy this kind of presentation because in the veterinary world, we are not used to them. But sometimes this is what the people with money, ministries of treasuries and finance, this is the kind of information they have, even though it could be estimates. Anyway, the next presenter is Dr. Andre Kosa. Dr. Kosa is a technical lead for rabies in Sub-Saharan Africa for the Global Alliance for Rabies Control, Garc, as you know it, where he's involved in working with different national governments and organizations in development and implementation of their rabies elimination strategies. More specifically, Dr. Kosa focuses on supporting the implementation of strategic dog vaccination campaigns, implementing and enhancing rabies surveillance systems, and providing mechanisms whereby data-driven decisions can be made in rabies endemic settings. Dr. Kosa has also been involved in the development of many Garc tools, some of them might have used, such as the Rabies Epidemiological Bulletin, the Rabies data, Garc data logger, the Garc education platform, any specific courses, and the stepwise approach towards rabies elimination tool. Dr. Andre Kosia, please.
Good morning, and thank you for the opportunity to give a brief overview of some of the tools and resources that can support the implementation of mass dog vaccination campaigns. Immunity. Despite this, anyone who has planned, implemented, or taken part in a dog vaccination campaign, whether it targeted the entire dog population or only the at-risk dogs in a strategic manner, knows the following. There is actually a lot more that goes into a successful dog vaccination campaign. Amongst others, this includes the training of dog vaccinators, community awareness in terms of rabies and the importance of vaccinating dogs, and the ability to track and monitor the implementation of dog vaccination campaigns. While community awareness is an obvious element that is required and is also the easiest to address, what do the other two elements entail and how can they be addressed sufficiently? Without going into too much detail, the online platform contains a series of general and profession-specific courses. Amongst others, there are courses for the rabies educators, the animal handlers and vaccinators, the community coordinators, and the human healthcare providers. The fifth course, focusing on dog population management, is currently under development. While seemingly independent, these courses have been designed to complement each other and all empower people to undertake specific tasks.
Yeah, let me
Apologies, I don't know why the audio is cutting out. This is Dr. Andre Kutza. I'm happy if we have an opportunity to restart the video and mute the video. I can do a presentation as the video is playing as well, so that people do benefit from the information. Over.
Yeah, I think that's a good suggestion, Andre. Let's try that. Can you try that, please? And in the meantime, we can take 1 or 2 questions on any of the presenters while Andrea is still sorting this one. Any interventions for now? I see also Gregorio is back and he's been answering a lot of some of those OIE questions in the chat box. So please keep reading that one as well. You let me know when you are ready, Andre.
I am ready. Thank you so much.
Okay, thanks. Go ahead.
It can support them.
Thanks, go ahead.
So I think you can just mute the video's audio. I'll just narrate as we go through.
Okay, thanks.
So very briefly, I do apologize. We know from successful dog vaccination campaigns that essentially all you have to do is to vaccinate 70% of an at-risk dog population. And in principle, that does sound very easy and something that's easily done. But we know that the reality is that it's actually a much more complicated process. And there's a lot that goes around that, in essence, to reach those dogs. You do need your training and your preparedness, your community awareness, and your ability to track vaccination. And we know from experience that governments and organizations are very proficient at creating that community awareness and participation. But what tools and resources can one provide to support the other 2 criteria or the other 2 elements? And there are more elements that could be addressed and focused on, but we chose 2. And the first one is that the training of your vaccinators and all of your support staff. And your support staff and vaccinators require training not just on vaccination, but also on rabies prevention, the safe and humane administration of vaccine, and also bringing that community together and educating the community at the same time. And that's quite a diverse range of things to educate people on. And luckily, we do have various resources, and one of the most widely accessible resources is the Garc education platform, which is a freely available education website that addresses all of these needs that are outlined in the previous slide. And the main benefit is as soon as a person passes the final assessment, they get a certificate of achievement that showcases that they have mastered the coursework and that they are able to share that information with others. And the current website has 4 courses available in English and in French, with some courses also available in simplified Chinese and Spanish. The main foundational course seen at the top of the diagram is the Rabies Educate certificate, aimed at any person who wants to know more about rabies, how to share that information, how to communicate with people. And then we have profession-specific courses aimed at the animal health profession, the human health profession, as well as community health workers, community focal people. We have a 5th course, a dog welfare certificate course that is currently under development and will be launched in the near future, with this course focusing on community dog population management and dog welfare. And to date, we have estimated that our 7,000 graduates across the globe have reached 5.5 million people with information on rabies and responsible dog ownership through these courses, which showcases that every person makes a difference. The next component I'm going to be talking about is the tracking of vaccination progress, something that we've spoken a lot about yesterday as well. And we know from experience, not just in rabies, but in other diseases, that your ability to track where disease intervention has happened allows you to know where you have vaccinated, where you have not vaccinated, or where your vaccination coverage is insufficient. So where can you return to increase your vaccination coverage? From just the current media, we know that there's a vast array of diseases that do track the disease intervention. Most importantly or recognizable is the current COVID situation. We're tracking where cases are and where people have been exposed and where intervention has happened is in the forefront of all the media. Same can be said for malaria and even FMD. So why should it be different for rabies? Why should we not track where rabies vaccination is occurring? And the reality is you can do it, and the tools and resources are readily available. So there's no reason for countries to not do that. Right now, there are various tools and resources available in the form of mobile phone applications, computer-based programs, and then the Garc data logger, which Dr. Rana Thinga presented about yesterday. And all of these tools provide the same output, and they just fulfill certain specific needs. There's no tool that's necessarily better than the other when the global objective is to support countries. But what I would like to say is that the ability to track dog vaccination is available, readily available to anyone, any country who's using the Garc Rabies Epidemiological Bulletin. There are two freely available resources in the form of the actual website, as well as a mobile phone application. And we know that the Garc Rabies Epidemiological Bulletin, which is widely used across Africa as a comprehensive rabies surveillance system that creates a One Health data platform, and the data is government-owned and driven and is designed to assist governments in making data-driven decisions. But this platform collects national data, while we have an add-on component, the Rabies Vaccination Tracker, that allows governments to individually track vaccinated animals and upload that data to the Rabies Epidemiological Bulletin, where it creates maps and graphs in near real time. And once again, all the data that's stored on the REP belongs to the government. This data does not go anywhere without government consent and recognition. So these are just a few examples of countries that have used the rabies vaccination tracker. And in essence, they can see by logging onto this website at any point in time an up-to-date map of where vaccination has happened. And since 2018, more than 350,000 vaccinated animals have been tracked using the bulletin. And the reality is, how many more countries shouldn't be using this? We can also measure the impact of dog vaccination events. A successful dog vaccination campaign results in a decline in rabies cases. Not a sheer number of vaccine used, but a decrease in rabies cases as an indicator of success. And to do that, you need good real-time surveillance. In essence, another add-on component to the epidemiological bulletin is the rabies case surveillance, which facilitates the mapping and analysis of field and laboratory diagnosed cases, allowing countries to identify hotspots, direct their vaccination campaigns, and also see maps of vaccination data as well as rabies surveillance data on one instance. So once again, just 3 examples of African countries that are using this system to monitor where rabies or cases are occurring within their own countries. And all of this data is being presented by countries that have officially given permission for their data to be shared publicly. We know it's a transboundary disease and that it's important to share data with colleagues. So in conclusion, rabies elimination is a complex task, but there's no need to complicate things further. We have resources available to ensure that the staff can be trained, communities can be sensitized, and that you can track your vaccination and also measure that impact. And these tools are freely available to countries. So there's no reason why they shouldn't be used and why governments shouldn't use these tools to further their own efforts. I know this is a very brief introduction, but there is contact details there for any more information from anybody. Thank you so much, and apologies once again for the video that didn't work as it was supposed to.
Thank you very much, Andre. I think you handled the video issue very, very well. adapted very quickly to the new mode. And thanks for that presentation. And just to say, those tools that Andre is talking about, they are out there and working for reals, as you saw some of the countries. And I think those countries that have used them, please feel free to share your experiences as well. I know that even in Namibia, they were used very, very well with Rauna and her team and others. But thank you very much. Continue asking the questions, and let's continue because we are now almost 2 o'clock. Prof, can you continue? Thank you.
Yeah, I think we should. Thank you very much, Dr. Letshenoyo, and welcome everybody. I see we now 114 participants. We turned it a little bit higher number, but it's coming and going, but around about 120. Welcome to all of you, and thank you so much for joining us today for this webinar, World Rabies Day directed webinar. So next, we have Dr. Kennedy Lusashi. Kennedy is going to talk about One Health and integrated vice case management, and that's a key issue, and how these approaches and focus on integrated vice case management can help us to improve response to rabies exposures. And his experience comes from Tanzania and Chad. He's based in Tanzania, got a lot of experience, more than 10 years. I believe you're also a PhD student in the very, very final stages, so we wish you best of luck with that. But for now, we're really looking forward to this work that you've been doing. Thank you very much.
Thank you for the invite to this webinar. I'm Kennedy, and I will tell you about the experiences of implementing Ibcm in Tanzania. We all know that vaccinating domestic dogs should reduce rabies instances, but generally surveillance is very poor in countries where rabies is endemic, such as Tanzania. We therefore piloted an integrated bite case management, which is a surveillance system for rabies to investigate case detection. Ibcm is the form of One Health, which links health workers and veterinarians to work together in a more cooperative way. Results from this study have been published and can be accessed online. Ibcm has 3 steps. The first step is the risk assessment, which is conducted by the health workers. The second step is the epidemiological investigations performed by the national field workers. And then the third step is sharing of results. Normally, as part of Ibcm, health workers and veterinarians share information so that all exposed individuals receive the right treatment, and also measures are taken in response to the rabies outbreak. Now, this figure illustrates the current surveillance and reporting system which exists under the Ministry of Health and also under the Ministry of Livestock. So you can see that there is no direct link between the health workers and the veterinarians from this current surveillance structure. And another thing which you can see from this figure, that the livestock field workers, they do not do any investigation. They are supposed to be doing investigation, but in practice, they don't do it. And so what we did was to introduce an electronic Ibcm surveillance network into the already existing surveillance platform under both ministries. So we designed an Ibcm app which contains the risk assessment questionnaires to be completed by the health workers whenever they attend by the patient, and at the same time designed another questionnaire for the livestock field workers to complete after doing animal investigations. So to start with, if the health worker receives the bite patients, they will do the risk assessment, feed the electronic questionnaire, then upload data into the database you can see at the middle. So if it's found to be a high-risk bite, then the automated SMS will be generated from the database. It will be sent to the livestock field worker, who will be from the same area where this animal bite victim has come from. So the livestock field worker will do the investigations, and after completing the investigations, he will fill in the form, upload it into the database, but also send an alert to the health worker confirming the health status of the biting animal. If it's found that the biting animal is non-suspect for rabies, then the health worker may either continue providing PEP to the exposed individual or discontinue PEP if the animal is found not rabies positive. But at the same time, as this information is available to the Ministry of Health and the Ministry of Livestock, the Ministry of Health will know which health facilities don't have post-exposure prophylaxis, and then they will make them available for the exposed individuals. But also at the same time, the Ministry of Livestock will know which areas have high rates of dog rabies cases, and then they will know where to invest in mass dog vaccination. So this surveillance this surveillance network is being used across the study sites, and we are in the process of scaling it to include even areas which are outside our project. Now, this is the study site. We are implementing Ibcm in northern Tanzania, where we have the Serengeti National Park, and also in southern Tanzania, where we have the Seru Game Reserve. There are 35 wellness facilities implementing Ibcm, and these are either district-based facilities, district-based hospitals, or the regional referral hospitals which provide post-exposure prophylaxis. Now, if you look at the results, you can tell that across the 4 study regions, the number of bite patients increased after the introduction of Ibcm, and there were significant differences in the proportions of high-risk patients reported before the introduction of Ibcm and after the introduction of Ibcm, as you can tell from this table. Similarly, the investigations also increased after the introduction of Ibcm, and this can be clearly seen from this figure, which you can see. Overall, the figure shows the regional reporting of high-risk bites vis-a-vis the low-risk bites. The high-risk bites are the bars with the red color, and the low-risk bites are the bars with the gray color. But also the investigations at the black line, you can tell. Within 1 year of implementing Ibcm, we recorded a total of 16 human rabies deaths. And also there are some cases which are confirmed through the use of lab diagnostic tests to be rabies positive after doing an investigations. Though a lot of investigations were conducted, very few samples were collected. And investigations were done in 2 ways, either through phone consultations or in-person investigations. Through phone consultations, a lot of cases could be identified because the livestock field worker didn't need to move. So we just use the phone to consult the animal bite victim, so that he helps to identify if the biting animal is suspicious for rabies or not. If at all insufficient detail was obtained via phone consultation, that's when in-person investigations will be.
Good day, I'm Dr. Terence Scott from the Global Alliance for Rabies Control, and today I'm going to be presenting to you on World Rabies Day 2020 and how we're able to...
We're going to stop that because clearly something is wrong. Patrick, I'm going to revert to you because you're the technical guy operating all of the buttons at the back there. Perhaps you can give us indication if you want us to move to the next presentation and then restart that one later, or how would you like to proceed? Apologies, everybody. So clearly there's a technical situation, and we should have information on how to solve it.
The place is very poor in countries where rabies is endemic, such as Tanzania. And we are in the process of scaling it increased after the introduction of Ibcm, and this can be clearly seen from this figure, which you can see. Overall, the figure shows the regional reporting of high-risk bites vis-a-vis the low-risk bites. The high-risk bites are the bars with the red color, and the low-risk bites are the bars with the gray color. But also the investigations at the black line, you can tell. Within 1 year of implementing Ibcm, we recorded a total of 16 human rabies deaths. And also there are some cases which are confirmed through the use of lab diagnostic tests to be rabies positive after doing an investigations. Though a lot of investigations were conducted, very few samples were collected. And investigations were done in 2 ways, either through phone consultations or in-person investigations. Through phone consultations, a lot of cases could be identified because the livestock field worker didn't need to move. So we just use the phone to consult the animal bite victim, so that he helps to identify if the biting animal is suspicious for rabies or not. If at all insufficient detail was obtained via phone consultation, that's when in-person investigations will be done. Or if at all an animal attacked so many people and it has caused the enlargement of society, then in-person investigations will be performed. So what we can tell from these results is that Ibcm has greatly improved rabies case detection and communication between the two sectors, because we have seen a lot of animal rabies cases being reported. It has strengthened the communication ties between the two sectors, and also it has made them to work together with the community members in identifying rabies-related events. And also through the number of cases detected in both humans and both animals, we can see how effective the employed mass vaccination programs, how effective they are. so it can be used to monitor the impacts of mass-local vaccinations. That's what you can say about Ibcm. But also there are challenges related to the implementation of Ibcm, one which is the limited training health workers receiving the professional development. Health workers have to be trained on how to do the risk assessments. They have to be trained to give them a general knowledge on rabies and also know how to administer post-exposure prophylaxis. But at the same time, there is a perceived burden of real-time recording. This is because health workers attend several patients, not only related to mobility victims, so at times they delay in reporting the cases to the livestock field workers to enable them to do an investigation right away. At times they send information after a week or several days, and then when the livestock field workers do investigation, they find either the sample to have lost its quality, being unfit for testing and correcting, or at times they are not able to recover the samples, or the animal which have already disappeared. But also we have limited resources for the livestock field workers to do animal investigations. For example, the livestock field workers who there are not so many livestock field workers implementing Ibcm because they are few in number, but also we don't have enough resources in terms of fuel transport facilities and also diagnostics. This is a limiting factor for them to do animal investigations. All we encourage greater use of Ibcm, and recommend further implementation research to develop the best practice for Ibcm in different settings, as we all aim toward eliminating dog-mediated rabies from our societies. Now, from mid-2019, we scaled up Ibcm from the original 35 race facilities we started with. Now, there are 72 race facilities implementing Ibcm. You can easily see that in areas where rabies is endemic, such as Morogoro or Mala region, the number of investigations have increased. Also, the identification of high-risk bites have also increased. But in some areas, the investigations, very few investigations have been conducted, and also very few cases have been reported. We attribute the decrease in the number of cases in Twala and Lindi due to the ongoing or to the previous mass-local vaccination programs, which were conducted over four consecutive years. But also we are in the process of ensuring that each health facility in these study regions implements Ibcm, so that we really capture all the details related to rabies and we don't miss any information. We have been affected by COVID-19 during this time in one way or another. This is because we have seen very few investigations be conducted by the livestock field workers during this period of COVID-19, and we are seeing very few patients going to the hospital to seek treatment. This is not only related to rabies, but also to other diseases. Hospitals, the hospital workers, they are reporting that there are very few patients who are seeking treatment during this time, because they are afraid that maybe they may acquire infection from other people whom they don't know. But also some major facilities have suspended some of the common outpatient services during this time of the year because of the outbreak, and also we have not been able to scale Ibcm as per our initial plan. Our initial plan was to scale up Ibcm at the beginning of this year, but after the outbreak, we upgrade scaling up Ibcm. We hope maybe in the near future that's when we can do it effectively. Otherwise, I'd like to say thanks to my supervisors and mentors, to my host institution, Tripartite Institute, and the project members, the project funders, and the government, specifically the Ministry of Health and the Ministry of Livestock, for allowing this research to be implemented without any problem. And also, I thank you all for your time and the passion to listening to this presentation. I urge you to adapt Ibcm in your own settings. Thank you.
Thank you very much, Kennedy, for that very nice presentation. I want to ask you about one specific statement that you made, just to clarify it for us. I think I know what you mean, but just to get it in your own words, you said Ibcm, and I believe integrated vice case management is critical. It's a critical element to rabies control program. So I'm absolutely all for the more tools we can develop to do that, the better. But you say Ibcm has potential for monitoring the impact of mass dog vaccination. And I wonder what you mean by that in your own words. And then I also want to refer to some questions in the chat room.
Okay. When I say that Ibcm had a potential to monitor the impact of mass dog vaccinations, we know that when we vaccinate dogs, we expect to have reduced the cases of dog rabies, and through implementing Ibcm, because we are doing a lot of investigations on animal rabies cases, also confirming on whether they are suspected for rabies or not. If we find out that the number of animal rabies cases are low or are becoming very low, and then at the same time we're doing mass dog vaccination, and then we know that I think the surveillance is good enough and that it's working.
Okay, no, absolutely. So well understood. Thank you very much. There's a question in chat from Dr. Ryan Wallace, in which he essentially says that he was surprised to see an increase in your presentation in the proportion of high-risk exposures with the implementation of Ibcm. He says what they find is that they are, when they apply Ibcm, they get more reports of cases, but these are low-risk cases. So it's kind of an opposite finding. And he's asking if you have any explanation for that. That is also in text in the chat box. So you can respond now if you wish, otherwise just by typing your answer. Now, if you could, since we have you on the line.
Thank you. I can respond to that question. Yes. No, most of the dogs which we have in Tanzania, they are free roaming dogs. So at times someone is attacked by a dog which is unknown and you can't know its status and it disappears. When a person goes to the hospital, we regard all those people who are bitten by unknown dogs to be of high risk. That's the reason why we have a lot of animal bite cases being referred to as high risk, because they are bitten by dogs which we don't know their status. And for that case, we recommend post-exposure prophylaxis to be given to any person who is bitten by an unknown dog. And another thing that previously normal health workers will provide post-exposure prophylaxis to any person who will come to the hospitals without taking the history. And now, after taking the history, and also after considering that if any person is attacked by a non-dog or dog which disappears, or which if someone's attacked by a dog and it's killed immediately, and then we have to recommend post-exposure prophylaxis. I think that's the reason why we have so many high-risk cases being reported compared to the situation when we had not introduced Ibcm.
Okay, I think you've explained your rationale very well. There is a response from Dr. Wallace, which I also agree with, and I think if we could, there are some other questions out there as well. There's a question on the cost and cost effectiveness of Ibcm programs. There are a number of individuals on this call who's experienced in Ibcm programs, including you, Kennedy, and others on the call. So if you want to contribute to that answer, you are all very welcome. But for now, I think we should move on to the next presentation as time is not on our side. So I'm going to hand over to you, Dr. Letseneo.
Thank you, Prof. And thanks, Kennedy, for that good presentation. The next presentation is going to be from Dr. Terence Scott, who is going to talk to us about the World Rabies Day 2020, continuing rabies awareness during the COVID-19 pandemic. Very interesting topic indeed. Dr. Scott is a technical lead for rabies at the Garc. We've already talked about the Global Alliance for Rabies Control. Terence's responsibility primarily focuses on the coordination and development of the World Rabies Day, the Rabies Epidemiological Bulletin, and the continued implementation of the SAR, or the stepwise approach towards rabies elimination, towards the development of national plans. He's a member of the PaRaCoN Regional Rabies Control Network Steering Committee, and through such networks provides technical in-country trainings and support to national governments and other stakeholders to assist efforts towards rabies elimination. Dr. Scott, please.
Hey, I'm Dr. Terence Scott from the Global Alliance for Rabies Control, and today I'm going to be presenting to you on World Rabies Day 2020 and how we're able to continue raising rabies awareness during the COVID-19 pandemic. World Rabies Day is celebrated on September 28th every year, and this is the anniversary of Louis Pasteur's death, who who invented the first rabies vaccine. So what is World Rabies Day really about? So primarily it's about raising global awareness about this 100% preventable disease. We need to ensure that everyone is aware about rabies and that they understand what needs to be done to eliminate the disease. And this ranges from communities all the way up to the stakeholders and decision makers who are implementing national and international rabies elimination activities. It's also about spreading the message about rabies and how we can eliminate it. We need to inform others about how we can work together and how we can eliminate this disease by sharing important information with them and ensuring that the message is spread to all interested people, to all rabies endemic countries, to ensure that rabies can be eliminated on a global scale. It's also about uniting people towards a common public good, and this is where the One Health approach becomes very important, where we're uniting the different sectors from animal health, human health, environmental health, and the various other sectors like education and many, many more, uniting them together to work towards the common public good of rabies elimination. And we need to work together, we need to ensure that we work together to reach this goal. It's not only about the professionals though, it's also about uniting individuals and communities together so that they can work together towards rabies elimination. Lastly, World Rabies Day is also about telling our stories and sharing our successes. And this is extremely important as we need to tell our stories to make people aware of this terrible, terrible disease, and also share our successes to make sure that people remain involved and remain interested, and that rabies elimination remains a priority for all those stakeholders and decision makers. So what is the theme for World Rabies Day 2020? The theme is End Rabies, Collaborate and Vaccinate. And these are three very, very key points. So the first key point is End Rabies. And this reminds us to keep focus on the goal of 0 by 30, or 0 human rabies deaths from dog-mediated rabies by the year 2030. It also reminds us of the End Rabies Now campaign, which helped us to set this goal in line with the Sustainable Development Goals. It reminds us of collaborating, so working together and partnering with others, using the One Health approach and bringing together communities, individuals and professionals to really achieve success, because we know that we cannot achieve success without working together. So the last point is to vaccinate, and we know that vaccination is absolutely critical to rabies elimination. We need to vaccinate our own dogs, vaccinate the dogs in our communities, whether they are owned or unowned dogs, whether they are confined or free-roaming dogs. We need to ensure that we reach that 70% vaccination coverage to eliminate the disease. And we also need to ensure that enough vaccine is available for humans to receive post-exposure prophylaxis if they are exposed to a suspect rabid animal. So in total, we need to ensure that there is enough vaccine and that the vaccine is getting into those dogs that need to be vaccinated, and that there is also enough vaccine available for people to receive post-exposure prophylaxis when needed. So how can I celebrate World Rabies Day while there is a COVID-19 pandemic? Well, we can celebrate in many, many different ways, and there are many examples out there. You can look on some of the events that have been registered on our website already, and you can draw inspiration from previous events. But importantly, there are many different ways that you can practice it, even remotely, using social distancing. And one such way is through social media, where we can help to spread the knowledge and information about the disease and raise awareness through social media. We can use videos and radio broadcasts to ensure that the message and the education about rabies elimination can reach millions of people around the world. There are also online courses available. We have online courses on the Garc education platform where You can learn about rabies, understand it, and encourage others to also undertake these courses and learn about the disease and how we can prevent it and eliminate it. So who can take part in World Rabies Day? So of course, people from the animal health sector can take part. People from the human health sector can take part, such as doctors and nurses. Professionals such as scientists or laboratory technicians working on rabies can take part. But it's not only professionals who can take part. People in communities can take part. People who are sitting on their couches at home can take part. You do not need to be a rabies professional to take part in World Rabies Day. In fact, anyone can take part in World Rabies Day, ranging from children to musicians to rabies professionals. Anyone can take part, and we encourage everyone to take part in World Rabies Day. So let's celebrate together. Let's raise awareness and educate others about this disease and work towards its elimination. And we encourage you to register your event on the World Rabies Day website. I'm going to touch then on the World Rabies Day Awards for 2020. So the World Rabies Day Awards are there to recognize champions in their communities who are doing great work towards the elimination of rabies. And the awards are threefold. So firstly, the winners will receive a prize of $1,200 to help them or their organization's rabies elimination efforts. They will receive global recognition for the work that they are doing. This includes through promotion on our website and newsletter, through social media, and also global recognition through the form of a certificate and prize. And the third benefit is promotion. So Garc will promote your work as a shortlisted awardee and a winner. And we'll ensure that the great work that you are doing will be reached and shared with tens of thousands of people around the world, ensuring that the work that you're doing is recognized and that you receive the recognition and support for the work that you're doing. So unfortunately, the World Rabies Day Award nominations have closed, but that doesn't mean you can't take part, and we would encourage you to vote for your favorite nominee and ensure that they receive the recognition and the prize for the great work that they are doing. So we look forward to seeing you here on September 28th on our global map of all the registered events, and you will then see that your event will be registered here and you will receive global recognition for the work that you are doing. So in summary, to help you participate in World Rabies Day, you can plan your event, and we have resources to help you with this on our website. You then need to register your event on our website so that you can be featured there and also be promoted globally. And you'll also receive a certificate of recognition for registering your event on our website. You can then use our free resources that are designed to assist you in making your event a success. Of course, you then need to celebrate your World Rabies Day event in whichever way you choose to do it. And most importantly, you then need to share your experiences with photos and stories about your event. Help us so that we can promote your event and make sure that it reaches the global audience to raise awareness about this disease, and so that we can all work together towards 0 by 30. So I'd like to thank you very much for your attention and encourage you to register your event on the World Rabies Day page of our website so that you can be globally recognized and take part in this annual event to help eliminate rabies and raise awareness. Thank you very much.
Thank you very much, Terence, for that good presentation, reminding us that we are living in the days of COVID, but we have to continue the fight for rabies, of course, safely, do it safely. So thanks very much for that motivation. I could not see any specific question in the chat box to you, but questions are welcome as we keep on checking. Yeah, I think, Prof, over to you, sir.
Thank you very much. Yes, indeed, there was a discussion on Ibcm, Jonas Waldo, you had that specific question. There's some discussion around that, which I think is will be useful to you. And I see you have already acknowledged that. And thank you, Terence, for the presentation on World Rabies Day, as that is really what we are focused on this month. And in just a few short days, we will be at World Rabies Day. So to move along, we have a last presentation, and this is from Aziza Ben Sharifa on the OIE campaign, which is called Rabies Ends Here. And that is the communication, specifically the OIE communication campaign. And so she's been working in Paris as a communication officer and was part of the team that developed this communication plan, Rabies Ends Here, and she's going to tell us more about that. So thank you very much. Looking forward.
Hello everyone, my name is Aziza Ben Sharifa and I work as a communication officer in the OIE communication department. I was part of the team that coordinated the development of the OIE Rabies Ends Here communication campaign, which I will present to you during this webinar. By the end of this presentation, you will know a bit more about the #Rabies digital community, the tools of the campaign, as well as the way that you can use them and adapt them. The Rabies Ends Here campaign was created in 2019 by the OIE. Its objective is to raise awareness about the disease and to convey a simple message, which is we can cut rabies transmission and eradicate it at its animal source by vaccinating dogs. Basically, the main idea highlighted in this campaign is by increasing the number of vaccinated dogs, we can make rabies ends here, hence the name of the campaign. To achieve this objective, we wanted to generate a sense of pride in the people who have had a dog vaccinated against rabies, and to have their action acknowledged by others who did the same. This is how the digital #Rabies Ends Here community was created, and I will talk a little bit more about who is part of the community and how to be part of the community just now. The targets of the campaign and the #Rabies Ends Here community includes dog owners and more broadly the communities in which dogs are present. It also includes veterinarians, vet students and the veterinary services, as well as rabies stakeholders. It basically gathers all the people involved in rabies vaccination. The campaign have tools that targets all these audiences. So for example, for dog owners, the objectives is for them to vaccinate their dogs and inspire others to do the same. For the veterinary services, the veterinarians and the vet students, it's for you to adapt the campaign if needed and to disseminate it and to disseminate its tools among your network at a local level. And for the rabies stakeholders is of course to support the cause and to spread the campaign among their network as well. The objective in common between all these audiences is for them to join the #Rabies Ends Here community and spread the message around them. The overall message highlighted by the community is across the world, people are mobilizing to stop the spread of rabies by having a dog vaccinated. They are proud of their action and they are showing it publicly on their social media platforms by sharing a photo of themselves with a vaccinated dog along with the #Rabies Ends Here. So it is that easy to be part of the community. You just have to post a message, a post, a photo, either with you and your dog or with a dog, and to include the hashtag of the campaign, which is #Rabies Ends Here. Before detailing the campaign itself, let's first talk about the two guides that you can see here. The campaign guide was created to help you navigate between the digital and printable tools that the campaign includes and to know exactly how you can use them according to the situation in your country. So whether you have or not rabies in your country, you will find guidelines on how you can use the tools that the campaign includes. The social media guide offers several ready-to-use posts and visuals that you can share on your social media. You can also get inspired by the key messages available on the guide to create your own posts. The advantage of using the OIE toolkit is to have the same coherent message across all the platforms and across all the organization, and therefore we will build a trust among the different audiences that follows us. Let's detail a bit more the tools. As said previously, the Rabies Ends Here campaign include printable tools. They can be used, for example, during dog vaccination campaign, but also during any planned event on the disease. We have posters, vaccination certificates, and flyers that can be distributed to create a sense of pride in having a dog vaccinated. You can also ask, for example, private veterinarians to display the tools in their practices and to give the rabies certificates when a pet owner vaccinates a dog against rabies. These tools can be fully personalized, either with picture of your own campaigns that are happening in your country, and it is also possible to include your ministry's logo on the posters. So now, due to the current pandemic and the restriction, maybe some physical events were postponed or cancelled in your country, and you might not be able to organize vaccination campaign or physical gathering anymore. In this case, you can use the digital tools of the campaign to promote rabies messages across social media. We have a Facebook profile picture frame, we have photo frames, and we have videos, and these tools are here to help you build and expand the hashtag Rabies Ends Here community. You can use all these tools across all social media platforms, and they help highlight the collaboration of the community and show their pride in putting a stop to rabies. So, for example, if you have a photo of a dog or rabies related, you can add a photo frame, and even if those photo frames can be found on Facebook, you can always share them on Twitter, LinkedIn, or Instagram if you have one. If you do plan to organize a rabies event, either for World Rabies Day or any other occasion, the campaign also includes a guide detailing the goodies with the messages of the campaign that could be developed. So, for example, we have some countries that have developed for previous World Rabies Day T-shirts that they could wear during the vaccination campaigns. Others have created stickers to distribute either during the events on the field or during workshop. So it's really up to you and to your budget and any idea you might have. So where to find all these tools? All of them, including the campaign, social media, and goodies guides, can be found on the dedicated Trello platform, and they can be downloaded in 6 available languages, which are English, of course, but also French, Spanish, Russian, Mandarin, and Arabic. So last but not least, in order to gather the hashtag Rabies Ends Here community and offer a place where our action could be shared with the members, the OIE has created a Facebook event for the World Rabies Day 2020. We post regularly messages about the disease on that page. We do polls to raise awareness among the members of the community that are not necessarily familiar with the disease, but also members post photos of themselves with their dogs or photos of dogs that have been vaccinated with the hashtag Rabies Ends Here to motivate others to do the same and to also join the community. I would like to invite you to join us in this Facebook event and to share with us your World Rabies Day celebration. The link to the event is available on Trello, or you can just type the name of the event on Facebook. The name is Rabies Ends Here World Rabies Day 2020. And yeah, you can click on participate to the event and join the community there. You can also invite your friends, your family, and your network. And actually, the bigger the community is, the better chance we have to go viral with our message to raise awareness about rabies. And the more likely we will be able to inspire and encourage people to help us in the fight to make rabies ends here. thank you for your attention. Like I said, do not hesitate to join us in the event and to share with us your pictures of your World Rabies Day celebration. You can do it either on the Facebook event directly there, or you can also send them by email to the communication unit. We will be really happy to receive them and see what kind of celebration you organized. And yeah, I wish you a happy World Rabies Day and a successful one.
Thank you very much, Aziza. That was a lovely presentation to end off our program today. I think we've had a wonderful program. We've had updates from everyone. I think just looking at the feedback from the delegates, it's all very positive. Looking at the interesting discussions and the I think. Probing questions that I think show that it's not business as normal for us. We really want to move forward, and in this way we are doing it. Thank you to everybody. Thank you for everybody for your thanks. And I'm going to hand over to Dr. Letsuneu, Dr. Mutapela, for your final comments, and also thank you for co-moderating so effectively today.
Thank you very much, Prof. Always very nice working with you. This has been very good. We have come to the end, but there will be a closing, of course. But just a few announcements. I saw somewhere circulating, some saying that the French meeting has been cancelled. This is not true. This is not true. The French meeting will start at 4 o'clock Central African time, or 2 o'clock UTC time. So it's starting about an hour and a half time. So that meeting is on. Please do attend the French-speaking version as well. The other very important development is that tomorrow there will be a communique. There will be a statement, a joint statement from the Tripartite, being WHO, OIE, and FAO, and the Global Alliance for Rabies Control, where Professor Louinel is the director, and some of his staff were talking today, like Terence and Andre. So there'll be a joint statement tomorrow from this about the World Rabies Day. And I also want to take this opportunity to thank the people behind the scenes. This is very, very interesting technically. It's not as simple as it may look. We have people like Dr. Bastiansen, who are working behind the scenes, Dr. Tenzin, who is working behind the scenes, Dr. Alessandro, Dr. Wakusama, and support from our OIE headquarters colleagues and the Tripartite colleagues, as well as regional representatives, and yourselves as well for bracing this event. The participation has been amazing since yesterday. I really enjoyed this, this meeting. And let's remember that through collaboration and vaccination, we can end rabies by 2030. I think at this stage, I have the pleasure to call Dr. Gabriel Abebe, who is the Regional Director of FAO based in Ghana, in Accra, Ghana, to close the meeting for us. Dr. Abebe.
Thank you. Can you hear me?
Yes, we can hear, sir. Go ahead.
Yes, thank you so much. Abebe Haile Gabriel, Assistant Director General and Regional Representative for Africa, FAO. I hope Dr. Karim Tunkara is around, but I extend greetings to him.
I'm around.
Okay. OIE Regional Representative in Africa, representatives of WHO and other partner organizations, distinguished delegates, dear colleagues and friends. Let me start by congratulating the FAO, OIE, WHO tripartite partners for organizing the webinar that was conducted these couple of days as part of celebration of the World Rabies Day. I believe the good way for me to start these closing remarks would be to acknowledge the progress and achievements made already, because we will only be building on the progresses. The information you shared over the last couple of days attests to the fact that well-established partnerships and effective collaborations between and across the public and the animal health sectors are essential to control rabies globally, regionally, and nationally. Through the global strategic plan to end human days from dog-mediated rabies by 2030, we have collectively defined the objectives, the tools, supported development of national elimination plans, improved rabies diagnostic capacities, strengthened surveillance and enhanced information sharing, and made other interventions that are mitigating the impacts of rabies. In this respect, I would like to commend the continued efforts of the national authorities, local communities, and the private sector. Their commitment and contributions are essential for success, and they have helped create and capitalize on the ongoing momentum to end human days from dog-mediated rabies by 2030. I cannot overemphasize the significance of embracing the One Health approach towards rabies elimination, which essentially necessitates multidisciplinary, multi-stakeholder, and multi-sectoral engagement and collaboration at all levels. I'm sure you'll bear witness to the fact that FAO, OIE, and WHO are making efforts to routinely work in this manner in Africa. The regional tripartite that we have established, as well as today's event, substantiates our successful One Health regional partnership endeavors. As communicated in previous sessions, FAO is actively supporting rabies control activities. Our teams are supporting efforts in building national and local capacity for rabies diagnostics, risk mapping, risk communication, and risk mitigation. For example, FAO supported a massive dog and cat vaccination campaign in Tanzania, where 30,000 animals were vaccinated in 2018, and similar activities are taking place in several countries on the occasion of this year's World Rabies Day celebration. In collaboration with Sebeveriha, FAO is currently implementing a rabies program in 8 countries in Central Africa. I would like to take this opportunity to express our gratitude to all the funding partners for their support. Colleagues, distinguished participants, it's very important to realize that only 10 years are left to attain the objective of eliminating human dog-mediated rabies globally by 2030. The task remains immense in our region. As you are aware, Africa is experiencing one of the highest rabies burden in the world. We all must remain committed, continue to overcome the challenges, and we all must remain mutually accountable for contributing towards our shared goal. To succeed, we must continue to overcome the challenges we face. We need to critically assess the progress we have made thus far, and we need to continue to deliver in priority action areas such as effective use of vaccines, medicines, tools, and technologies, and sustaining human and financial resources. Because rabies elimination plans are country-centered, we need to recognize and foster country leadership and to build consensus within and across One Health platforms, technical working groups, the academia, research institutions, municipalities, civic society organizations, and the private sector. No one can do this alone, and we are all in this together. Finally, let me state the obvious. We are celebrating the World Rabies Day 2020 in an environment of COVID-19 pandemic, which affects everyone in every country across the world. However, its impacts have been more pernicious on lives and livelihoods of the most vulnerable. Tackling it requires strategic, holistic, and innovative approach, as well as robust international and regional cooperation. Our actions on rabies elimination will unavoidably interface with our response to COVID-19. I'm pleased to inform you that FAO's COVID-19 response and recovery program identified among its 7 priority areas the prevention of the next zoonotic pandemic through strengthening and extending the One Health approach to avert animal origin pandemics. We look forward to impactful collaboration and partnership around this priority area. On behalf of Food and Agriculture Organization of the United Nations FAO, I would like to express my sincere appreciation to all the participants for taking time out of your busy duties to attend this important webinar. I thank you for your attention, and please continue to stay safe. Thank you. Over to you.
Thank you very much, sir. Thank you very much, everybody. The meeting has been closed. Don't forget the French meeting starting in 1.5 hours time. Thank you very, very much, and have a good day.